I went from saying at the beginning of the pandemic, first of all, I thought the press was causing the panic. I didn't realize it was coming from our government, other sources. And I was like, don't listen to these people. Listen to the CDC and Dr. Fauci. I've worked with these people for years. They will get us through this. And man, was I wrong. Holy moly. I didn't know what had happened to those organizations. And I went from that to, wow, these organizations that were advisory to physicians to help us make good decisions are now trying to usurp they're trying to tell us how to practice medicine. That is insane. And as that became more and more clear to me, how insurance companies and hospital employers and regulators were taking over medicine, I became a freedom fighter. And then when my speech started getting constricted, that's just unimaginable to me. In this country, the First Amendment, the very first principle of the Bill of Rights, is being infringed upon, and people are questioning whether we should have less free speech. Holy crap. I can't believe we're there.
Do you think there are some psychological conditions that actually are kind of impervious to therapy? And the reason I'm asking you this is I am on, as of tonight, I will be watching the final episode of The Sopranos. It's my third go-around. Did you watch it?
Yeah, no, spotty. I've never watched it through and through.
Okay, but you know obviously about the Soprano mafia family and that he's in therapy.
Yes.
And one of the interesting things, I'm not blowing this because the show came out 20 years ago, but one of the interesting things is in the second to last episode, there's been a through line that Dr. Melfi, his therapist, has been struggling over the course of the years, trying to figure out, is she actually helping him at all? Or is she actually, by allowing him to talk, is she in some ways emboldening the lies and where he can compartmentalize his life? And then her therapist, because she also goes to a therapist, basically presents her with a study about a certain personality disorder and says, this is what you've got on your hands. And she breaks it off with him in the second to last episode. It's really incredible television. And I'm wondering if you've ever encountered any of that sort of thing where you suddenly, not necessarily in your private practice, where you suddenly just say, there's nothing that actually can be done here, at least within my skill set.
100%. It's not uncommon. You'd be surprised. And there's a sort of a subset of it that I deal with more than not, which is not ready. These people to change, much like addicts, they're everything. They have to be threatened with survival, frankly, before they're willing to change. And that's true of what you're calling personality disorders. And there is the sociopathy, and which is what we're talking about here with Tony Soprano, and antisocial becomes criminal at a certain point, and the only way to solve that is with constraint, with some sort of external force, because they just will not trust. They will not enter the frame. They will not change. They see everything as the problem, not them. And anybody trying to help them is sort of full of shit. So why would they listen to them? And it's funny, I had a patient of mine who was very much in that zone. It was a woman, and she started with, it was funny. She started with, I had somebody in the room with me. We were working with her, and she started with sort of an open position, and then she put her hands over her head like this, which is a position that primates make when they're acknowledging a superior position and an openness to the other person. And then she went from that, and I thought, oh my God, we're making progress, to this, and then just this. It was just, I thought, wow, that's the full evolution of criminal thought right there in front of
Wow. So you think what was going on in her head, actually, she was acting out, in some sense, all of those
were body language manifestations of, I'm listening to you. Oh, you're making sense. Wow, I like you. I know you. I trust you. I'm open. But it's sort of like a alpha male talking to an alpha male will, if one is listening to the other, the chimpanzees do it. You'll see it. It's crazy. And then when they've had enough, it just closes up. That's it. Back to, it's all BS. Why am I bothering? So
what's that like for you when you've been in practice dealing with somebody where you get to the end of the road with them and you don't get I'm sure there's been moments where you get to the end of the road and you go, boy, I've set this person up properly in life. But to go the other way, I mean, man.
Well, I don't do a lot of that kind of work. I do teamwork with drug addicts, but I will tell you how that works in a second. But I would try to get that person to somebody who specializes in personality disorders. There is such a thing. And
Yeah, that's
I
what
was,
she did, by the way.
I was
She tried.
right. And I was listening to a podcast recently where a guy, one of these therapists, a psychiatrist, was in there, and he said, this severe narcissist was in there, and he was telling me this horrible story of abuse in his childhood. And he goes, I don't normally evoke emotion in the interpersonal context of therapy, but I started to cry, and the narcissist went, "Why are you mocking me?" So that's how much they distort the outside world. You see how that works. The addict, they become disruptive. I give them 3 strikes. They're out. That's that. And I cannot tell you, there have been many, many, many times that the person I kicked out of treatment, and sometimes they surprise me. If you offer drugs to somebody else, you're out immediately. If you have sex with somebody else, you're out immediately. But if you use drugs yourself, I actually give them chances. I give them other chances. But if you hurt somebody else, you're out. I can't tell you how many times people come up to me 3-5 years later. I don't even recognize them. They're so different. They come up and shake my hand. They go, I'm in a PhD program for psychology now. I wasn't ready to hear what you were saying at the time, but you setting that limit with me and kicking me out is something that helped build my motivation where I finally got better.
Does your immune system feel off ever since COVID? A recent study published in the Journal of Clinical Laboratory Analysis suggests you might not be in the clear even if you feel fine. Researchers analyzed blood samples from people who had recovered from COVID and found something concerning. Their platelets, which are crucial to healthy blood clotting, were still not functioning properly even months after recovery. Other studies have identified lingering spike proteins in bloodstream and organs, contributing to immune system dysfunction and even mitochondrial damage, whether from the virus itself or the mRNA vaccines. That's why Dr. Peter McCullough developed Ultimate Spike Detox, a doctor-formulated blend designed to help your body recover and rebuild. It includes nattokinase, which helps break down the spike protein, bromelain, which supports immune system function, and turmeric, which reduces inflammation and promotes cellular repair. Take back control of your health. Head over to twc.health/Rubin and use code Rubin to get 15% off plus free shipping. Again, that's twc.health/Rubin and use code Rubin at checkout for 15% off. It's time to own your health. What feels more rewarding to you? Is it the ones when you had like the intimacy of the clinical practice and they're coming in meeting with you all the time? Or is it that you can do this at scale now and, someone who you've never met will come up to you at the airport or whatever and say, boy, Drew, I did listen to Love Lines way back when, and I had some weird stuff going on, and you helped me sort it out.
I've always been doing them both side by side the whole time. So they're just different to me. I mean, I'm trying to figure out, we have a sick society on our hands essentially, and I'm trying to figure out how we can use cases again to help kind of move that in the right direction. That's been and we're sick. We're still sick, man. We are still, I kind of feel like we're getting better or something. If we can get back to families, if we can get families healthy again and empower families and do good child rearing, it'll come back fast.
So I do think we are on the comeback right now. I feel it very strongly, actually. I think a lot of it's hard to see because of the algorithms and because of our conditioning to negativity or what people click.
Yep.
But it does seem to me that more and more people suddenly care about family or care about what they're putting in their body or are a little skeptical of COVID and blah, 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 blah. I mean, even your very public evolution as it pertains to trusting some of the institutions, I mean, it's powerful stuff, which is why every time we've talked about it, it goes viral.
It's stark. I went from saying at the beginning of the pandemic, first of all, I thought the press was causing the panic. I didn't realize it was coming from our government, other sources. And I was like, don't listen to these people. Listen to the CDC and Dr. Fauci. I've worked with these people for years. They will get us through this. And man, was I wrong. Holy moly. I didn't know what had happened to those organizations. And I went from that to, wow, these organizations that were advisory to physicians to help us make good decisions are now trying to usurp they're trying to tell us how to practice medicine. That is insane. And as that became more and more clear to me how insurance companies and hospital employers and regulators were taking over medicine, I became a freedom fighter. And then when my speech started getting constricted, that's just unimaginable to me in this country. The First Amendment, the very first principle of the Bill of Rights, is being infringed upon, and people are questioning whether we should have less free speech. Holy crap. I can't believe we're there, but it's been my evolution, and there's been lots of other little sidebars to it. But I am fully there. We got to fight for these things. I didn't, Tom Sizemore once told me, I love Tom, and I'd known him for many, many years. And he said he was preparing, I think he was preparing for Black Hawk Down. And he went and he lived with a sort of colonel in the Air Force or something. And the guy came to the door and went, all right, you can hang around here, but I'm busy fighting for freedom in this world. I'd fight for the freedom of this country, and that's a full-time job. And we both were like, this guy thinks he's fighting for freedom. I think about that guy all the time now. Thank God that guy was there fighting for freedom, and the guys like him. And now it's got to be all of us. All of us.
If you're craving more honest and thoughtful conversations about politics, check out our politics playlist right here. And if you don't want to miss any future videos, make sure to subscribe and hit that notification bell.